These 3 mice are blind due to a genetic defect. These mice were once blind as well. From birth, the special cells in the retina of their eyes would not respond to light. But now they've got some sight back, thanks to a breakthrough in experimental transplant surgery. For the first time, scientists have successfully transplanted key light-sensitive cells into their retinas, and crucially, done it in such a way that they work, the cells connecting to the optic nerves to the brain.
We're taking cells, sort of individual cells if you like, and we're transplanting them in such a way that they become fully incorporated into the host retina and make electrical connections. And we've shown for the first time with our experiments that when you shine a light in the eye, these transplanted cells can respond to the light and drive electrical signals which make the brain realise that the light is switched on, basically restoring vision.
Mice and humans can see because we have millions of light-sensitive nerve cells on the retina at the back of our eyeballs. Most of them are rods that let us see in low light levels. They're the short filaments in this photograph, while the rest, the cones, give us colour vision. But in people with diseases like age-related macular degeneration, the cells die off, causing loss of vision and blindness.
Just look straight towards me, please.
Lucy Farrer's retinal cells have been dying off since she was 3.
Everyday tasks are made so much more difficult. Just walking down the road, making sure you don't bump into things, seeing numbers on buses, getting on the right train, not being able to see the boards.
And if the technique could ever be made to work in humans, she'd be very happy.
About 20 years ago we were told there was no hope, there's never going to be a cure or a treatment, sort of don't go chasing any ideas. 20 years later here we are, and there's a treatment around the corner. Obviously it's a few years off yet, but could make a huge difference to me and to other people suffering from retinal degeneration.
These mice here have all had cells transplanted into their eyes, and they clearly have no difficulty seeing. This is a significant breakthrough, but there is one big catch before this technique could be used on humans in the clinic. And that's because we develop at a different rate to mice, and it's simply not possible to get the right cells for transplants in humans. But the scientists here believe there is an alternative, and that's to use stem cells.
There's actually a population of stem cells within the adult eye. So there's a region just behind your iris called the ciliary margin. And previous reports have shown that these cells have stem-like properties. So you can actually take these out during routine eye surgery and take them into the lab, grow them up in the dish, and then transplant them back into the patient's own eye.
Stem cells might be the answer for people like Lucy, because uniquely they can be made to develop into many different specialised cells. Making them become the particular cell you need for an eye transplant, though, is still a problem to be solved, so a useful clinical treatment is still years away.